So this weekend, we had a patient who had come to see you. Oh, it's been a while ago. Came in from Pensacola to see you for his back pain. Can you talk about that?
Backs. Yeah. That was a younger patient actually, been dealing, his 40s, early 40s, had been dealing with back pain for about a decade, or over a decade.
I know his wife was tired of hearing him complain about it.
Yeah. And finally encouraged him to come and see me. Interesting case. He just had back pain after a number of sports-related injuries, and when he came in, he was unsure of the methodology, but we talked to him at length about prolotherapy and about the different potential solutions that we could use.
Non-surgical solutions.
Yeah, and so prolotherapy is a technique that was developed in the 1940s, really. The first prolotherapy attempts were by an orthopedic surgeon who had actually traumatized his finger in a door. And so he injected himself with a dextrose solution with excellent results. And hypothetically, he was thinking that would stimulate repair in the area. At any rate, it went on to continue to be utilized by that surgeon, creating actually what became medical orthopedics. So medical orthopedics then developed with prolotherapy using different solutions of substances that would initially just initiate proliferation in that area, hypothetically, and the data for that was not obtained until many years later. But at the same time, different solutions were utilized ultimately by different practitioners that provided results far beyond expectations. So the practitioners that utilized it were in the Midwest mainly, and the technique developed so that it was needle injections into and around the joints that were traumatized, resulting in proliferation of the healing cells in those areas, and then resulting in significantly decreased or resolution of pain, and really excellent results. So very few practitioners initially. It's been a very slow development over the years, but now it's much more commonplace. And we started using it. I started using it about 10 years ago, and initially started with the injections of dextrose and PRP very early on thereafter, and with the availability of biologics with stem cell components and the particles contained in stem cells, exosomes, began using that on different joints and different musculoskeletal injuries and other areas. So, I've gone off on a historic tangent here, but at the same time, the patient that came from Pensacola actually came and we did his procedure with, it didn't take very long, it took about a half an hour. No general anesthesia, just local preparation with local anesthesia in the area of the back to be injected. And he tolerated the procedure very well. He had some soreness a few days following the procedure, but after about 6 weeks, he had significant reduction and then complete resolution of his back pain. His back pain was related to early degenerative arthritis and muscular soreness from his workouts and those types of things. That he was an avid bodybuilder and recreational exerciser. So we saw him this past weekend, and he had it's been 5 or 6 years now.
No, has it really?
Yeah, I think 4 or 5 years. 4 or 5 or 6 years. And his wife informed us he had no back pain whatsoever, had complete resolution subsequent to the prolotherapy with and I used biologics on him. I used Morton's jelly, and he was quite complimentary, and we were fortunate to have run into them. But the process takes about 30 minutes. It doesn't require general anesthesia. You do have to avoid the usage of non-steroidal anti-inflammatories, and really a very simple procedure. It is uncomfortable during the procedure. However, with the appropriate preparation, we really get great results. And I've been fortunate over the years I've seen many patients, and not only that young man, but farmers, people who have developed more significant degenerative disease, have responded in kind. Although in his case, he only needed one set of injections with the biologics. I have had to use 2, and the most I've ever used is 3, and that's exceptional. The most I've ever really used is 2, using the.
You mean 2 treatments or 3 treatments spread apart?
2 sets of injections spread apart by 3 to 6 months.
Awesome. Thank you.